about radiotherapy. During this time, we go to the step 2 because during the medical therapy, they're gonna have like a side effect. So we're gonna take care of this step as well. People may have oral mucositis or candidiasis, or any people who have the dependent status. People who cannot come to the hospital, cannot go to the dental clinic, they're at home, they cannot move. So we have to move ourselves to meet the patient, right? So in this area, Dr. Kanyarat, who is the wife of the dean, take this responsibility. We try to collaborate this program with the undergrad course and also in the project response as well. In the undergraduate course, we have the community practice. They send the top student to the area. We need really go to the faculty that and do some more examination and also some treatment. These patients don't need advanced treatment, just a functional basic. In some hospital right now, we gonna develop a special dental clinic that is try to manage the patient has special need care for these 3 areas. Okay. And for the Dr. Kanyarat, they use many things like social right and travel to manage their patients. Now they have many patients. And also, sometimes we go to the rural area to give some dental treatment. In this case, the patient, when she was about 10 years old, she got like don't have enough copper in their blood, so they got some syndrome. So and she cannot go to the hospital to receive even the medical treatment. So when we go to the rural area, we have to visit her as well. In our team, we work together with the faculty of medicine in Chiang Mai University. Okay? So we have to go to big team, and when we go there, we spend about 5 days or 7 days to give the treatment. In this year, we went for 7 days, and we can give the dental treatment for 1,133 patients. Quite a lot. Okay, in this year, since 1 October last year and to 30 September this year, we have many projects, about 36 projects. 7 Royal Family projects, 17 Statistic King project, and also the 8 project of the faculty. These are some examples, and you see some medical unit, and we have many dentists from the faculty and also from outside the faculty as well, and for alumni. Okay, here in the field that we give them some treatment. Okay, so the next part we will talk about the another kind of patient in the specialty area as well that will be presented by Dr. Kathiravan.
I think I'm the last one from our school to sharing our speech with you, and my topic is change, and sometimes we cannot deal with them by our own. I don't know that you manage them here, but I think we're gonna hear from you later. Okay, so I just want to show you, this is our student at Chiang Mai University from pharmacy school. She's a pharmacy student, and she got crowned as Miss Thailand this year, and she was also a president of Student Association of Chiang Mai University, and her campaign is CMU for All. Let me show you a little bit about when the moment that she was crowned on stage, and she did the sign language, to talk to people with disabilities, And also, if you notice, this is her skirt. In Thailand, but we still, want to make our dentistry for all. We want to make equity. We actually provide, treatment for all kinds of patients, but I would say in terms of equality, we do not really take care of them as we're supposed to, and we have doing a lot of good work, like my colleagues have mentioned to do earlier, but in some part, like for example, like cleft lip and palate, we have already like the 10th meeting, like have the networking all over the country, and also about nasal form that my colleague already mentioned about it. But in some area that the director of the hospital, Dr. Chichiro, already mentioned, we're not doing very well in that area, but we are trying very hard, to improve in this area. And my responsibility is, to also try to get, all people in our dental school to get involved in adult with intellectual disability, because for them, there are so many challenges in this group of patients, because they have uncooperative behavior, they have concomitant systemic diseases, some known and some are unknown, and higher risk of oral diseases, and the home care is very difficult because they are very dependent. And our school in the past have some limitations because we are dental school based, not hospital based, so some dentists we are not very used to the case with severe systemic disease, and we don't have specific training or workflow in this area, and more importantly, we don't have any specialists in special care dentistry for adults. For kids, pediatric dentistry is about you treat them, but it depends where they are sent to. Some people, if they are with us since they were young, they will still be with us. But if they walked in when they're older, sometimes they were sent to family and community dentistry or oral and maxillofacial surgery. But need also helps a lot in this area, and also operative dentistry, oral medicine, endodontics, and prosthodontics. We've done a pilot clinic in the past few years, and this year, like Dr. Shunati said, we're about to have postgraduate level. Every discipline have to learn about special care dentistry, and also we have the elective clinic in oral care for intellectual disability, and also undergraduate students have to take this discipline as well. And for right now, we have just dental treatment in the dental chair every Wednesday afternoon, and also for the full mouth rehabilitation under general anesthesia is once a month. So in the past, we do of child development. Pediatric dentist has been taking care of him, but now he got periodontitis, so they refer him to our school. So we just use a simple technique like distraction, like counting. This is like 1, 2, 3, 4, 5 in Thai, and also he actually is quite cooperative because he has been trained since he was young, but he's making some noise and not be still for a very long time. So we're singing to him, try to distract and try to decrease anxiety for him. This is just a simple procedure. I'm the one who's singing and show my friend, who's not here, she's a periodontist, who helped me with the root planning. So we're working as a team, and I think my friend now, she kind of get more confident and not afraid of this group of patients anymore. Okay, and finally, if they have a lot of work to be done, their systemic disease or their cooperation is not, well suited for treatment in dental chair. Like in this case, it's a cerebral palsy patient with epilepsy. So our colleague in community dentistry, which is Dean's wife, Dr. Kathiravan, went to a home visit and found her. So she sent her over to get all the treatments done, and we try to, like I said, to expand the knowledge that we have in pediatric dentistry and combine with other specialties. We're doing a training. We're inviting, collaborating with other schools, and we're inviting Professor, actually he's from Chicago, USA. And
to tell you, although you are not Miss Thailand Universe 2023, in my opinion, you got much more great crown than her, since you work by treating patients especially with your special heart. And we come to the end now. And we have 25 minutes for breaking time, right? After that, we come back to this room again. Okay. Breaking in this room. And after that, coming to the next part with the special lecture from the Balaji Dental Hospital and College staffs. Thank you.